Hi guys, it's Cricket, and it is day 8 of National Endometriosis Awareness Month. Tonight I thought we'd take sort of a humorous, comical look at the treatments that are available for endo warriors, just to let you know what sort of a problem we're up against. When I was first having my surgery and possible diagnosis for endometriosis, my surgeon told me before my surgery that he recommended that I do a course of injections or some type of treatment to help heal from the surgery. And he said there were a couple different options. The first option was a course of injections that he said carried some side effects he wanted to discuss with me, like my voice deepening. Oh, really? Okay, voice deepening, right? Well, is that temporary? Is that permanent? That seems sort of problematic, but you know, okay. Possibly, if I really have to do this, possibly. And then he said another side effect was growing facial hair. At that point, I said, you mean like a beard? Like I would get a beard? Well, he says it depends. Every woman is different. As he started telling me these things, and I read further that it would cause possibly acne on your back and face and other things, I thought, well, that does not seem like something I'm willing to cope with. The other option was the better of the two, but also equally possibly as disturbing, was I'm in my 20s at this point, and those injections, equally as powerful, and I was told needed, and they would put me into a chemical menopause. So hot flashes, mood swings, anything that's associated with menopause. I would experience those things in my 20s. So I did go that route and do those injections. They did cause me to have neuropathy and permanent damage. It turns out I was in the 1% category of severe side effects. I was in that 1% category. So it left me with permanent neuropathy and problems. I developed bursitis in my hips in my 30s. Bursitis, yes. Also another condition associated with someone who's not in their 30s. So I'm in my 20s getting these really powerful injections, this drug they use in men with prostate cancer, actually, the injections that I had. Very expensive. Thank God I had insurance. Women who are uninsured, the cost of these injections would be prohibitive for them. Even though they put us in a menopause and they're not great, it's still a treatment that is recommended for us. So those are just a couple of the options that I was up against. Remember also, there is no way to diagnose endometriosis currently with a blood test or any imaging. Although you can see ovarian cysts or endometriomas, which is also something that happens sometimes along with endometriosis. There is no definitive imaging or blood test that diagnoses endometriosis. The only way to definitively diagnose endometriosis to this date is laparoscopic surgery, which means making small incisions and going in with laparoscopically to see if a surgeon can find endometriosis on your organs. So, although I can look at this sort of in a humorous way, I do want us to remember these are the options that women face every single day. Difficult choices. I remember sitting in my surgeon's office thinking, these are my choices? Like a beard or menopause. These are your choices, Donna. Which one do you want to take? So it is day 8 of National Endometriosis Awareness Month for 176 million of us. It's also 365 days a year. So I'm Cricket. Thank you for watching. I'm Cricket, and I'm an endo warrior.